when it gets into the brain, now we know that the psychedelics activate a particular type of G protein coupled receptor, a GPCR called the serotonin 5-HT2A receptor. It turns out, and I've given talks on this, but I don't have anything I could bring up to show probably. It turns out that in our cortex, the outer layer of the brain, there are these receptors, these 5-HT2A serotonin receptors are expressed on an area of those neurons called the apical dendrites. And the brain, the cortex, is like a massive parallel processing biocomputer, if you will. There are these columns that are stacked next to each other all throughout the cortex. And information from our senses, our sense of touch and taste and hearing and vision, they all get processed. And there are areas in the brain that filter that to decide what's relevant for our survival every day. So everything that we pick up doesn't get processed. A lot of it is screened out. So the relevant information from our senses gets transferred to these cortical pyramidal cells, which are kind of like the central processing chips in a computer, where all the information goes in there, and then they integrate it and create our sense of, if you will, our sort of sense of reality. So neurons are little like electrical components, and the membranes of these neurons in the brain have a certain electrical potential across them. That's how they work. They're like not exactly like wires, but they fire at certain threshold currents, and then they produce their own little current. So if you give a psychedelic, what it does is it changes the electronic membrane potential of these cortical pyramidal cells. So you can imagine, if you think about just an ordinary computer that has all these different components inside, if you change the way that processor processes information, it's not going to produce the same information. And that's basically what happens in your cortex. You change the membrane potential of these cells, which are the computational units in the cortex, and it makes them fire more easily when they get a signal. So they will pick up lower level signals. It increases their gain, if you will, their ability to amplify. So normally, these are processing the information in the way that we were evolved to process information. So you put a psychedelic in and it changes the electrical membrane potential of all these cells in the cortex, which are processing all of the information we get about it, the environment and our imagination or whatever. And so when you change that electrical potential, they fire differently. They accumulate information in a different way. So it modifies our perception of what was coming in. So it's just the same as if you would somehow, say, damage the central processing chip in a computer and it doesn't work right. That's sort of what happens. It isn't a damage. That's maybe not a great analogy, but it changes the way they produce information, the way they integrate information. And that's basically it in a nutshell.
Can action at this receptor explain some of the results we're seeing in research studies today, such as significant decreases in patients' anxiety and depression following the administration of psychedelics?
It does and it doesn't. We know that those receptors, when they're activated, will lead to, at least in the small studies so far, will lead to alleviation of depression, anxiety, some addictions when coupled with psychotherapy. But there's some change that occurs, and we're not sure exactly what that is. The speculation is that they change the number and arborization of these dendritic spines on neurons. So neurons communicate, they're just not wires. They have branches. Like if you imagine a neuron being like a tree, the branches would be like the dendrites. So imagine if you had a tree with all these branches and you cut a bunch of the branches off. So now the tree has got maybe few branches. It doesn't really thrive very well. That's what we think happens in depression, that these neurons lose their dendrites or their branches are pruned back. And so the serotonin 2A receptor seems to stimulate the regrowth of those dendritic branches. So it's a dendritogenesis or spinogenesis. So it stimulates the regrowth of these dendritic branches on the neurons. And we think that's what happens. And that seems to be the thing so far that's been identified that leads to antidepressant effects or these changes in drug seeking, et cetera. But that's really not, it's not really clear. We're sort of on the threshold of trying to understand how it actually works. Some of the newer brain scanning technologies are giving us a better look at what happens within the brain itself in terms of networks in the brain, how the neurons talk to each other. But actually how it produces an antidepressant or anxiolytic effect, we don't really understand that yet. This is a speculation about it stimulating the regrowth of dendrites. That's the best idea we have so far.
There's also a lot of people who, especially psychedelic therapists, who think that it's not actually that they change something in our brain, but that it's processing of the trauma and sitting together and being witness, having the therapy around it.
So all the studies that have been done so far have involved psychedelic assisted therapy. So there are some people that think that the therapy is essential. There's other people that think, well, maybe it's not really that important. No one really knows. There are theories that after you take a psychedelic, there's a certain window of time that's available. It's like when you're young and your architecture of your brain is developing, that think that this window opens up, and then if you do therapy, that you can stimulate this regrowth of dendrites or changes with the therapy. I'm not sure how strongly I subscribe to that, but that's the paradigm people are using, because there are situations where people have say using recreational drugs, a dose of LSD, and they have an intense mystical experience, and their depression just goes away, and they've had no therapy. They were just taking it recreationally, and suddenly they feel much better, that their depression is gone. So I'm not sure how necessary it is, but right now with trying to reinvigorate this field, all of the studies have involved use of a psychedelic coupled with some therapy, especially with alcohol use disorder, things like that, or tobacco addiction. Because what happens, and I think this is important for end-of-life patients and also addictions, various addictions. There's a cognitive component that people get a perspective they haven't had before. So for example, if you're trying to treat someone with a psychedelic who has alcohol use disorder, is addicted to alcohol, what happens during the effect of the drug is, first of all, before you give them the drug, there's a period of therapy where you talk about, when did you start drinking, what got you drinking, what do you think about when you drink? You basically get people to focus on the process of their use of the substance. And then they're primed. So Stan Grof said that psychedelics are unspecific amplifiers of unconscious processes. So you're primed to think about your addiction. Or if you're dying, obviously, you're thinking about your impending death. So you're primed for your brain to be thinking along those lines. So then when you take the psychedelic, it amplifies those unconscious things. You think back, like, when did I start drinking, and why do I drink, etc. And it's just saying that doesn't have the same effect. These drugs actually have a powerful impact on your thought processes. So if you're thinking about, when you started drinking, you actually may be taken back to when you started and experienced the feelings that you had then, and why did you keep on, and what did it do? Or for someone who's dying, they've been primed to talk about their experience with their family. Did they have a loving family? Were their parents loving, or did they have an unhappy childhood, etc.? All these things will come out because the psychedelics really amplify those unconscious processes, your thinking processes. So we can, you and I can sit here and talk about somebody having a thought about dying and how horrible it must be to be facing death. But the effect of a psychedelic is to really intensify that. And so when Charlie Grove did his first study of cancer patients, his third patient, we had a video of her. Her husband never got over her death, so he asked us to take it down. But she talked about what happened, and she said, and I watched the video, and she said, what happened was when I took the psilocybin, I saw death as this big dark figure that was outside me, and I recognized this was my death. I was going to die. But she said at the same time, I realized I'm not dead yet. I still have life to live. She had the doctors had given her a 6-month prognosis to live. She lived for 2 years. And she and her husband, she got into an exercise routine. They changed their diet. They started traveling. So the quality of her life in those last 2 years before she died was dramatically improved because she saw death as something over here that was darkness. And she still had life inside her. And she said, I'm still alive. I'm going to live my life while I'm alive. And that sounds, we just talk about it like what's just communication. But under the effect of the psychedelic, it was very powerful for her. This thing that she saw as her death, and the fact she was still alive, was an extremely powerful emotional thing for her. And so, in the first study that Johns Hopkins did with Roland Griffiths, they gave psilocybin to healthy individuals. And a large percentage of them said that taking a psychedelic was among the 5 most important things they'd ever done in their life. And so this is the power of these psychedelics. They really can give you an intense experience that you can't get in any other way.
It's interesting you mentioned palliative care. I don't know if you've seen Dosed too, the documentary about lady dying of cancer who tried psilocybin. So she was given 6 months to live as well. And she took psilocybin, and it just awakened the will to live in her to a degree that she recovered a bit enough to start then taking cannabis oil, and just took loads of cannabis oil and slept a lot because she was taking very high dosages. And I think it's 2 or 2.5 years later, and she's still alive and doing well and looking great. So this is very, very, very promising for palliative care.
We sponsored, Heffter sponsored Charlie Grove's first study of cancer patients because that was the one indication in the the 60s and 70s that showed the most promise, where people were treated with mostly LSD, and they got pain relief, they got a new perspective on death. It really changed their outlook. And I think when people talk about trying to develop a psychedelic that doesn't have psychedelic effects, for people with just ordinary major depressive disorder, it may be that you could develop something like that somehow activates the same receptor but doesn't have the psychedelic effect. But I think for end-of-life patients and in addictions, that really serves an important function. I don't think if you're dying, taking a pill just doesn't change your perspective on death and dying. Or if you're addicted to alcohol or any substance, just taking a pill doesn't change that necessarily. But there's a cognitive part here where they talk about, what effect it had, how it affected them. They realized when they started and how much it was damaging their family when they kept using and so forth. So there's a cognitive component that's really amplified by the psychedelics.